Good evening and welcome to the COVID-19 update on Channels Television in collaboration with the Ford Foundation. I'm Millicent Walker. Here are some of the highlights this hour. Benue State government expresses its readiness to participate in this year's West African Examination Council, says schools have been decontaminated. Anambra State Sector Command of the Federal Road Safety Corps begins tour of motor parks to enforce compliance to safety standards and COVID-19 preventive measures. And the World Health Organization warns that the drop in routine immunizations could cause more harm than COVID-19 itself. According to the Nigeria Center for Disease Control (NCDC), 10 deaths were recorded in the last 24 hours in 5 states, 3 in Delta, 2 each in Edo, Kwara and Lagos, while Enugu recorded 1. 463 confirmed cases were reported in the last 24 hours from 17 states, while 121 cases were discharged in 10 states, 25 in Edo, Rivers 20, Lagos 19, 17 in the FCT, 17 in Gombe, Borno 9, Kaduna 8, Kano 3, 2 in Ogun and 1 in Sokoto. Zamfara and Kogi still have 0 active cases of COVID-19. Sokoto State has 1, Jigawa 2, while Yobe and Bauchi have 3 cases each on admission. Meanwhile, the total confirmed cases stands at 33,616. Those that have been discharged, 13,792, and the death toll in Nigeria at 754. More airports across the country are now open for flight operations after about 3 months of shutdown following the outbreak of the COVID-19 pandemic. This is according to the resumption schedule from the Ministry of Aviation, with the airports in Akwa Ibom, Edo, Kwara, Kaduna and others expected to reopen today. Our correspondents gathered that in Uyo, the Victor Atta International Airport in the Akwa Ibom state capital today resumed flight operations. Air passengers who spoke to journalists at the airport expressed satisfaction with safety measures and protocols at the airport.
Quite efficient, quite organized. Yes, of course, it's going to take a bit of getting used to, but I'm sure after a couple of flights, everybody will be on top shape.
The service is okay. So for the airport, the medical people, they are trying their best.
It feels like now we are living. You know, it's like everything ended, everything stopped for a while. But now I think we can move from one place to the other easily. So it's better.
In Kwara State, the management of Ilori International Airport says they are ready and prepared, but only waiting for the certification to go ahead. At the airport today, the measures to curtail the spread of the pandemic were seen, such as floor markings for social distancing, provision of hand-washing facility, infrared thermometers for passengers.
We are fully prepared, but as the regulation in the aviation industry demands, we are waiting the NCA, this national regulatory body, to certify the airport ready. Without them, we can't do anything. We can't operate. So that's why we are waiting for them, and we're expecting them on Friday to come and certify our facility in readiness for the operation. As soon as they certify the airport, we are good to go. As you can see, all the necessary markings and sensitization that depicts the regular protocol as demanded by the NCDC and the aviation regulatory body. We are already complying with them, putting them in place so that we are ready to go. It's just that we can't operate without the certification of the NCA. That's what we are waiting for. And they are coming, we are expecting them on Friday.
Meanwhile, our correspondent in Benin City, Edo State capital, reports that passengers hoping to use the Benin airport may have to wait a bit longer as the facility appears not ready to resume domestic flights. When Channels Television visited the airport, there were no passengers at the facility, but airline operators and officials of the Federal Airport Authority of Nigeria. The arrival and departure terminals were, however, wearing a different look in line with the COVID-19 guidelines, with work still in progress. Last week, flight operations resumed at the airports in Lagos, Abuja, Kano, Port Harcourt, as well as the Maiduguri and Owerri airports. Now over to Benue State, where the government has expressed its readiness to participate in this year's West African Examination Council, as it says schools have been decontaminated. According to the Executive Secretary of the Benue State Teaching Service Board, if the Federal Ministry of Education would comply with the House of Representatives resolution to go ahead with the examinations in spite of the COVID-19 concerns, the strict adherence to safety protocols would top its arrangement. Here's more from our correspondent, Pius Angro.
The impact of coronavirus on Nigeria's economy is really taking its toll, particularly on education, following last week's cancellation of WAEC examinations by the federal government for fear of infection among students if they return to school. However, the Benue State government has said if the federal government would permit them to reopen schools for WAEC candidates, just as the House of Representatives has directed, they have made adequate arrangements, particularly in spreading the students across more classrooms so that social distancing will be a key component of that arrangement.
And we've put on all the modalities to provide all the hand sanitizers and enlightenment campaign to make sure that the students coming back maintain the social distancing, all the rules of COVID-19 and all whatnot. We've also put in place a committee who is also observing, implementing the fumigations of all the schools in Benue State.
As it stands, the State Action Committee has put the figure of confirmed cases in the state at 127, with about 6 deaths recorded. I know that about 65 of them are active right now, and every effort is being made at the isolation center by medical team to ensure that these persons get healthy, get treatment, and are safe. From Government Model in Makodi, Pius Angbo for COVID-19 update.
The targets for COVID-19 testing in Nigeria set by the Director General of the Nigeria Center for Disease Control (NCDC), Dr. Chikwe Hekwazu, on April the 28th, 2020, is to test 2 million people in 3 months. It's almost 3 months since that target was set. He made that statement in April. But the country is nowhere near this projection. And this is what we're seeing April 28th to June 28th. If you see the difference in the difference in 1 month between May and June, indeed, turnaround testing has been remarkable. But when we take a look at some good news where the NCDC number of molecular laboratory testing centers across the country, it has moved from below 10 as at the end of April to a total of 52 at the moment. The not so good news is that the total number of COVID-19 samples tested in the country is still below 200,000. In fact, it's standing right now at 199,016. Nigeria's current daily samples tested is still below 5,000. Now, let's compare that, Nigeria's testing capacity figures, to some African countries using the Worldometer's info data, and you will see that South Africa is way ahead, conducting over 2.2 million in terms of the number of COVID-19 tests it has done. Morocco is next in the North African region, and it has pulled off over 915,000. Ghana is next, and when we look at West Africa, you have, of course, Nigeria first, and then Ghana second in terms of the number of cases, but then Ghana has tested much more, over 331,000 tests done so far since the virus outbreak. Ethiopia is leading in East Africa with its numbers at a little over 250,000 tests that have been conducted. So that is Nigeria. We told you about Nigeria's, of course, total figures. But before now, the major challenges to the COVID-19 testing were centered around inadequate testing facilities, also not enough screening reagents. But now the NCDC has identified sample collection logistics at state level as a gap that needs to be filled. The agency advised state governments to mobilize their health teams for massive sample collection that indeed must also follow standard protocols. And there have been several solutions to that. But the samples tested in the top 5 states, and this is as at July the 7th, 2020, this is how they ranked. Lagos State has screened far more number of people, 44,000 plus in the FCT. The next, of course, 20,000. Oyo is next, and we have Edo and Rivers. These are the top 5 states with more COVID-19 cases in the country. But part of the efforts to ramp up the country's testing capacity is the production of local test kits, and this is aimed at reducing dependence on importation. Last week, the federal government of Nigeria announced the newly developed and validated indigenous test kit for the identification of the SARS-CoV-2, the causative reagent for the virus. But no country knows when the total number of people infected with COVID-19. Also, we know that the infection status of those who have been tested, all those who have a lab-confirmed infections, are those known to be called confirmed cases. But this means that without testing, there probably is no data. We have a medical laboratory scientist. He's also a virologist and public health epidemiologist, Dr. Akiala Ishaku, who joins us from our Abuja studios. I'd like to thank you for joining us at this time.
Thank you, Melissa.
All right, let's begin by asking, is Nigeria testing enough and testing enough to monitor the outbreak? Because we're being told by the Presidential Task Force that it's relying on this data to make its decisions to keep us safe.
So if we are testing enough, my answer is no. This is because we don't have key performance indicator to actually measure whether we have tested enough. And this is because we need to test enough. So the answer is no, we have not tested enough. WHO forecast for Nigeria for the month of July is that by now we should have tested 40% of our population, which is running into millions. So we have not yet done enough. There is need for us to actually look at where we need to optimize our protocols. There is need for us to also see how we can be able to go into robust community testing. There is need for us also to see how we can be able to optimize certain guidelines. Melissa, I hope you know that the case definition that suit for symptomatic patients is different from asymptomatic patients. So my expectation is that as we begin to open our airports for activities, I expected that every passenger should be tested. And then there is also a need for us to also bring in the issue of rapid diagnostic kits. So if we are going to go into community testing, massive community testing, there is need for us to look at rapid diagnostic kits that are being used in the US, and we can begin to validate them in this country and then begin to see how we can be able to test more. I want to also see that even the engagement of the 774,000 people that the federal government intends to employ, 1,000 per each local government. I am requesting that the Presidential Task Force can begin to see whether we can begin to have like 200 to 300 per local government health workers that can be able to be enrolled and then be able to go into robust sample taking. We have the capacity to do community testing. If we cannot be able to activate molecular labs at our various locality in local government, we can begin to station sample collection points. So it behoves on state government to take ownership of this pandemic. State government have not done enough in taking ownership. Lagos is a trailblazer to this. Lagos is setting the pace, but I expect that most states are supposed to take ownership of this pandemic.
We appreciate your time. Thank you so much, Dr. Akiala Ishaku, medical laboratory scientist, virologist. Thank you for joining us on the program.
Thank you. Thank you for having me.
Still to come on our COVID-19 updates, testing remains the window to the pandemic and how it is spreading. We have someone from the NCDC for more on that. Join us again.
Let's the council of this state will disinfect. Then when they come back
And as
again,
interstate movement continues after the ban was lifted weeks ago, the Anambra State Sector Command of the Federal Road Safety Corps has commenced a tour of parks to enforce compliance to safety standards and COVID-19 preventive measures. According to the sector commander, the exercise is necessary to protect fleet operators and commuters amidst the pandemic.
our bodies. We have started the inspection and monitoring of motor parks and fleet operator terminals here in Anambra State. We have visited about 4 parks this morning, and it's going to be a continual exercise. The exercise is for them to ensure that they obey the COVID-19 protocols put in place by the government. And to ensure full compliance, we have said that we are going to monitor the operations, and we have commenced since last week. So it's going to be a daily effort for the Federal Road Safety Corps. And again, some of them have the emotion that because they are senior physically on ground, we are going to be sending plainclothes staff here to monitor their operations so that they comply fully with the COVID-19 protocols. You can see that the consciousness is there. They are complying. Only very just a few things that they need to put in place, which we have corrected them, and I'm sure they will improve on it. But what I've seen, I'm satisfied with what I've went on ground. Any fleet operator that refuse to obey the hygiene protocols will be sanctioned accordingly.
Let's look at more ways to flattening the curve. We have Dr. Yaya Desu, Head Risk Communication Division of the Nigeria Center for Disease Control and CDC. He joins us from our Abuja studios. Glad you could join us at this time. Let's begin testing. Where are we with reaching our goal of 2 million tests in 2 to 3 months? Have we also started deploying the RDT Swift kits?
Good afternoon. Thank you. Good evening, Millicent. Thanks for having me. And where are we? This is subject to so many factors. We have the supply side and the demand side. For the supply side, we now have over 50 laboratories across the country. And then this also includes the gene expert machines that have been converted to test for COVID-19. But for supply side, for demand side, now people need to come out to come and to make sure that they get themselves tested, particularly those who meet the case definition. That is the contact of confirmed cases, people in communities where transmission has been prevalent. So, so those people need to come out, and then the states also need to do more in creating demands and announcing where these collection centers are, and then to also make sure that they cite more collection centers. We also know that there are issues of logistics, which vary from state to state, and then I think states, after they take ownership, they should be able to see how they address this. So I think those are the major challenges. And then we continue to improve. Particularly now, private laboratories are also being activated. Lagos State is starting with that. And then as this, we have more of these on board. So we now have laboratories closer to the people. And then what this means is as we collect more samples, we have many laboratories where these samples can be processed. And then so we have a quicker turnaround time. So we still have a long way to go, but it's a multifactorial issue.
All right. Has anything changed perhaps in the last 1 month with regards to people's awareness of, COVID-19 and ways that they can protect themselves, the non-pharmaceutical measures?
With regards to awareness, we do weekly opinion polls that we conduct, and we continue to get the high percentage of people that that show that they are aware of COVID-19. But the question is perception of risk, and that is the major challenge that we are having now. People know that this is real, and this exists, but then they feel that it can affect them. or they are not vulnerable. And then when they don't believe that, the control measures, they are not likely going to believe in that too. And we also did a perception survey, and, which has also shown that perception of threats is low, and then perception of efficacy. When we say efficacy, we talk about the belief that those control measures will work, and then also confidence in implementing those control measures. So, and then we now find out that when we do, when we put them by each other, we have like a 2x2 table, and then we have a 4 boxes. And 59% from the survey that was done show that we have people who have low perception of risk and then low perception of efficacy. And that is sad for us because it means that they don't even feel this is there, and then they are not even bothered about what to do to protect themselves. We have 15% of them in the green zone, which is high perception of risk and a high perception of efficacy. These are people who are motivated to take protective, to obey the protective behavior. But what our messaging now is directed towards the people in the red zone, that is the low category. And it's more of letting them know the implication of this, because majority of these people, when we disaggregate this data by age group, we find out that many of them are youths who feel even when they get this disease, they are not likely going to suffer complications. But they can infect their loved ones, their parents, their uncles. Sometimes some of them depend on people that are not even close to them for maybe education and some other needs. And then if they get this virus, they move close to them, and those people die, then they will be affected eventually. So these are things that we all need to consider. And so we're already adjusting our messaging at various levels, and then we are also communicating this with all stakeholders to ensure that the right thing is done. So we segment the audiences and make sure that we have different messaging for different target audiences.
Indeed, Dr. Diso, and it appears to be, you know, a lot more work for the governments, the NCDC, and of course, Nigerians taking responsibility. Wish we had more time, but we appreciate your time, your thoughts on this issue. Dr. Yaya Diso, Head Communication Division with the Nigeria Center for Disease Control. Thank you for joining us.
Thank you for having me.
A significant number of children are missing out on life-saving vaccines for the first time in nearly 30 years due to the coronavirus pandemic. The UN identified a substantial drop in the immunization of children against diphtheria, tetanus, and whooping cough in the first 4 months of 2020. The suffering and death caused to children contracting these diseases could be far greater than the coronavirus itself, and also being suggested by the World Health Organization. Meanwhile, countries around the world continue to explore ways to curb the spread of the pandemic. From the NCDC, evidence on airborne transmission of COVID-19 reinforces the need for strict adherence to preventive measures. It says avoid mass gatherings, use your face mask, and continue, of course, to wash your hands. You can find the latest strategies to flattening the curve on their website. Also, a live feed of the World Health Organization gives you regular updates about the spread of the pandemic, and also strategy guiding the public health response at subnational and national levels. You can take a closer look at some of the numbers as well in real time. Our website, channelstv.com, has the latest news updates, the latest stories coming in there from Nigeria, Africa, and the rest of the world, all at your fingertips. channelstv.com. That's the COVID-19 update in collaboration with the Ford Foundation here on Channels Television. Thank you for watching. I'm Millicent Nwaka. Stay safe.